So once again, I'm very happy to be here with you. At the moment, I'm in the United States, in California, and we are preparing this series of health studies for the Gambia. And some of you who know me, I am a medical doctor from Colombia. I graduated from medical school in the year 2020 from the National University of Colombia. And I have done some studies on nutrition and some studies also in functional medicine. But today, what is important for us is to understand one of the keys in medicine, in modern medicine, is prevention. And some of the things I'm going to tell you today, they might sound repetitive, but sometimes we have to put the finger there where it belongs. And there is this founder of the United States by the name of Benjamin Franklin. He said that an ounce of prevention is worth a pound of cure. What this means means that once you have a problem, then you have to think about how to solve the problem. But what if you don't have the problem? So it's much better not to have an issue that you have to later on solve it than know how to solve it. Because when we talk about health, we know that our health could be affected in many, many ways. And today, as we are doing this health talks, I would like to focus first on this prevention stage. So, when we talk about prevention, we need to know how to prevent, and we need to know how to make sure that we know the environment where we are. Can you still hear me?
Yes,
Okay. Okay. So let's let's do this for this country that you may well know. It's called the Gambia. I haven't had the privilege to visit the Gambia and haven't had the chance to be there at the Gambia. The Lord allows me, I will probably visit you at some point. And what is most important in health, and when we talk about health, we talk mostly about public health, is that we need to know exactly what are we facing. So let's say if you want to defeat an enemy, you need to study well the enemy. Let's say now we had the World Cup and the soccer or football World Cup, and you saw all of these teams facing each other, and some of them got to the finals. And believe it or not, they study very well the movements of their opponents. And when we study health, we have to learn very good about the environment we are. This country, the Gambia, is a country that you will know is surrounded by Senegal, and it's a country that is considered the smallest country in mainland Africa. I'm not going to give you many details about your country, but it's considered that has a population of 2.7 million people. And also, when talking about health, you see that they have some prevalent diseases. One of them is malaria. You are very familiar with malaria, but regardless of how familiar we are, I'm going also to give you some health insights. We have also TB, tuberculosis. We have a big, we will say, con- uh, a big epidemic of HIV, and also acute respiratory infections, diarrheal infections, maternal and neonatal conditions, neglected tropical diseases, and non-communicable diseases. So when we talk about all of this, we need to see what are we dealing with. So it's very common that if you walk to a house in the Gambia, you might find some people suffering of one of these problems. So what to do in each case, it'll depend on how we are gonna treat or help this person, or help ourselves. So the first thing that I would like to point is that yes, it looks like you got disconnected for a little bit. Are you back?
Yeah, the connection is stable, isn't it?
Yeah.
Yes, but we cannot see you.
Okay, but you can hear me. Can you see the screen? Okay. Unfortunately, the connection is very unstable. But this this talk is being recorded. So if at any point we lose connection, I will continue till the end, and then I upload the talk and send it to you so you can watch it at a later time. But at this moment, can you hear me?
Yeah.
Can you see the screen that I'm
Yes,
sharing?
we can hear you.
Okay. So, what do we need to know to make a difference where we are? First thing we need to understand as well, we are not doctors. Specifically, I'm pointing this out because sometimes we want to become a doctor. There is nothing wrong in becoming a doctor, but it takes years of training. I am very positive that if any of you want to become a doctor, you will be able to do it. It takes long time. It takes studying many years. It takes practice, but anyone is able to do it. But for the purpose of this talk, uh, we are going to just focus on that we are not doctors. Well, I am, but we are going to talk in general. We are not doctors. So, what can we do if I'm not a medical doctor and someone has an issue? First thing, we cannot make a diagnosis. A diagnosis is just for medical doctors. There are specific tests for certain diseases. We don't guess. In medicine, we don't guess, say, oh, I think this person has this or that. We have to know what the person has. And when we are uncertain, we have to do some educated guesses. But these guesses are based on previous knowledge. Something else that we have to do is that we can teach prevention, how to prevent disease, what is practical in the environment I live. Also, we can understand disease. So, how is this disease gonna affect someone or affect me and my family? And also, we can learn how to lower the burden of the disease of the sick person. So these are very interesting points, and I would like to point that unfortunately, sanitary conditions in some African countries they lead to disease. And one of the first steps in helping in prevention is hygiene. So please please feel free to ask any questions about this first step, because hygiene is key in preventing any disease. Hand washing. If a person needs to go to a bathroom and go poop or go pee, the person has to understand that we carry bacteria in our poop, we carry bacteria in our urine sometimes, or uh, we have sometimes we touch surfaces, or we touch places, or we greet many people, we handle money. We have to, before we eat or before we do any other thing that relates to healthcare, or that we are greeting other people, a small child, so we have to wash our hands, and we have to use soap and water. Remember, at least 30 to 40 seconds washing with running water before eating, after touching pets, cats, dogs, any animal. So remember, this is very important. If you are going to make food, make sure that you are not on the phone. Some people like to touch a lot their phones. Their phones carry lots of bacteria, and these bacteria sometimes make you sick. If you go to the bathroom, remember, always wash your hands. If you're going to make food for your family, always remember, wash your hands. Have your hands clean every time you are going to put something in your mouth. Is very, very, very important, this part. I cannot stop stressing how much we have seen that diseases that can be easily prevented by hand washing are transmittable, because people forget about this basic step. And remember, if you cannot have access to running water, or you have no soap, and you need to do something, at least carry some uh, alcohol gel, so you can at least sanitize your hands, and make sure that whenever you are feeding, cooking, serving others, and handling food, you have your hands clean. Second thing I would like to stress is about oral care. For the ones that were in Bissau, you remember that we have a dentist there, Sister Santana, and she emphasized about how to brush our teeth at least twice daily, and floss. Is It's important. I see many brethren, Africans, they have the most beautiful smiles. They have perfect teeth. They have very nice teeth. And somehow these teeth get rotten, or they get cavities, and they get lost at very early age. Or, and sometimes it's just because of lack of oral care. And remember, oral care is very important for all of us, because if you have a cavity, you have a bacteria in your mouth, this can travel through your blood and cause a disease, even diseases of the heart, systemic diseases that shouldn't be there, just because you don't wash your mouth, just because you don't floss, just because you eat and then you go to sleep without washing your mouth. So remember, this is, you can't forget this step. Bathing, taking regular showers with soap and water to wash away sweat, dirt when you work, is part of this prevention stage. I won't stress this too much, but remember, this is included there. Grooming. Keep your fingernails short and trimmed and clean. I understand some people might work in construction, some people may work in the fields, some people might have some physical labor to do, and they get their hands dirty. But as soon as you are able, remember, keep your fingernails short. And if your nails are dirty, you can use a little brush to clean them, maybe a little toothbrush or a specific brush for the nails. So your nails are always clean and don't carry any disease in there. Specifically, because some people they have long nails and they are all dirty there. They keep a lot of dirt. And in this dirt, they carry bacteria that may cause disease. Something else is about respiratory safety. Cover your mouth and nose with a tissue or your elbow when you have to cough or sneeze. If you are sick, if you have a flu, you have influenza, you have any of these congested sinuses or congested nose, avoid going public places or avoid greeting people with your hands because you are going to spread this disease. And unfortunately, some people don't take this seriously. They go in public transport and then they sneeze and they share their virus, they share their disease with everyone. And although we like sharing, it's not a good idea to share disease. So remember, cover your mouth and nose with a tissue or your elbow. If you don't have a tissue, you have to sneeze. If you have a flu-like symptom, so remember, uh, make sure that even you use a face mask if you need to go somewhere, or try to avoid going public places if you are sick until you get better. Clean clothing. Wear fresh clothes every day. Change them if they get dirty or sweaty. Make sure that your body odors they are nice and clean. Sometimes if you have, all of us have bad odors. Sometimes we go to the bathroom and it doesn't smell so good. So make sure that you wash yourself, and if you don't have money for a perfume or some deodorant, the best we could do is lemon. You apply some lemon under the armpit. It keeps you, it might not keep you dry, but it kills you odorless. It kills some bacteria, because all of us produce odors. I am not gonna say, okay, no, no, only some people. No, all of us produce odors, and sometimes we do not perceive these odors, and other people do. Other people do. So when you dress yourself, try to use fabrics that breathe, that are breathable. Try to use cotton or linen or some fabrics that don't keep the sweat in. Unfortunately, this clothing that we buy today and is cheaper is plastic clothing. This, if you see uh, underwear, if you see nice shirts that don't get wrinkled, if you see all of these pants that they never wrinkle, you don't have to iron, it's because most of them they contain polyester, and these polyesters are derived from oil or petroleum, and they are uh, the same make of plastic. And and then we put ourselves, if you wrapped yourself in a plastic bag, imagine how you're gonna sweat. And if the weather is hot and you are wrapped yourself, you are clothed with plastic, then you're gonna sweat a lot and you're not gonna smell so good. So remember, baking soda and lemon, they are the most cheapest deodorants that help to have our bodies fresh and clean. Other thing is surface cleaning. So wipe down items and surfaces that people touch often to remove germs. If your table is people eat there, so try to wipe it, try to clean it. Your dishes, your everything that you use, make sure that it's clean, that you wash it with soap and water, that even though we don't have the latest silverware or things, that everything that we used to eat and that used to put in our mouth is clean and neat. Any questions so far? If not, you can write it down and we will answer them at the end. So this is the first step in prevention. We have second step, understand disease. What is to understand disease? To understand disease, there are several ways of classifying disease. One of them is time and onset of the disease. We can classify disease in acute, chronic, or subacute. Acute means that it's sudden start, fast progression, short duration, usually under 3 months. And it could be, let's say, someone was running and fell and broke a leg. So that's acute. It happened right there. And all of a sudden, a person uh, had a condition that uh, that happened right there at the moment. He got an accident, he got a cut, he got an injury. So that's we understand as acute. Chronic, it's a slow development, like long duration, lasting longer than 3 months, up to a lifetime. So some of these include diabetes, heart disease, and other chronic diseases that we have heard of. Sometimes people believe that a stroke or a heart attack is acute. It's, I will say, is acute because it presents right there. But this heart attack, this issue with your stroke, it didn't start right there. It might have started about 10, 15 years earlier, but you never realized that you had it until you had this acute onset of a chronic condition. And subacute falls in between acute and chronic. Symptoms develop slow and then acute, but they don't last as long as the chronic disease. So this is how we might understand disease, some of the diseases. Then there is another way of classifying infectious versus non-infectious. Like infectious could be caused by a bacteria, a virus, a parasite, and fungal. And these are external pathogens that may infect us. They come from the exterior and they invade our body, and then we have to deal with it. If it's a bacteria, we might kill it using an antibiotic once we identify the bacteria. If it's a parasite, we have to use some anti-parasitic drugs or something that gets rid of the parasites. If we get a virus, it's very few things that we could do because our immune system fights those viruses. But some of the viruses we have to take medications, such as like uh, HIV virus, that people have to be on medication sometimes even for a lifetime. And there are non-infectious diseases that they they don't have uh, to be they are not caused by an external agent, but mostly for something lifestyle or the way we live. There are some communicable and non-communicable diseases. Sometimes diseases that can be transmitted from person to person. Some people have, let's say, different sexual partners, and they get a disease from one, and then they get it, and then they communicate it to another sexual partner. And unfortunately, we see that this is the way that some people spread disease in many ways. And we have other conditions that are congenital. You are born with those conditions. Sometimes those conditions present at birth due to a genetical or developmental factors. And some of the conditions are acquired later in life. So these are different ways of that we could understand disease. And then are also another classification that I will say local versus systemic. So local is just a disease that affects a part of your body. Let's say you have a sore throat. You have a sore throat, then you have, if it's a bacteria, you use an antibiotic, you kill this bacteria. But sometimes this disease affects the entire body. There's diseases that causes uh, like entire body inflammation. You have inflammation in your joints, and you have pain everywhere, and or sometimes you get a bacterial condition in your blood, and these diseases can kill you. Any of the diseases can kill you, but when we learn, we understand what type of disease we have, then we are able to know exactly what to use. So, so the third step is know your limitations. So, as I said, we are not doctors, but at least the ones hearing me. First, that we need to understand, do I know how to help the patient? Sometimes I do how. And doctors, we don't know everything. Sometimes we have to call someone who is more expert, who knows more about it. Do I have, or do I know, or do I have the resources at my hand that are able to help this patient? Let's say I know how, but now do I have the resources? Remember the Good Samaritan. He was not only a good person, he was a wealthy man, and he was able to pay for the stain of uh, this person who was attacked and was wounded. And then later on, this person recovered. But sometimes, I know how to help the patient, but unfortunately, I don't have resources. I don't know what to do in that case. Is this a case that I can help? It's a simple case that I know, I understand, and I have the resources, I have the knowledge. Then there is something else. Is there a diagnosis? Is a doctor already diagnosed this condition? Are we for sure that this person has what I think this person has? Or am I guessing? So, and remember, we can't guess when it comes to disease, because sometimes our guesses might affect someone else's life. And they say, "Oh, I believe you might have this, drink this, take this, let me try this." And sometimes we don't, we are treating diseases, we don't know anything about it. With medications, we even understand less. So we need to make sure that we are truthful. If I don't know, I don't know, I have no idea how to help the person. So make sure you are honest. Say, I'm sorry, I don't know what you have. I have no resources. I don't have X-ray vision to see you inside. So if you get a diagnosis, maybe I can have a better understanding. But at this moment, I cannot help because, I might, give you something that might not help. If you can't help someone, try at least not to harm a person. If you don't know exactly what you're doing, and we all need to understand that sometimes, unfortunately, we can't help everybody, but at least don't cause any more uh, harm to this person. If a person needs to go to a hospital, it's perfectly okay. if a person can stay home and we can buy the medication and we can help them with a natural treatment, so let's do that too. And also, are there any health professionals nearby who can help us guide the treatment for this person? So these are questions that, even though they don't seem relevant to some, they are very specific and show us the ethics of when we deal with other people. So, so now that we have an understanding on how to deal with this, we better make sure that we are able to take the next step. So I have another step here. This word might not sound familiar to some of you because this is a word that we use in medicine. We call epidemiology. And I put it here just so you are familiar. Epidemiology is the study of how diseases spread, who gets sick, and why. No? So this is important. So so the goals of epidemiology is to find out who is getting sick. Okay, let's say this brother got high cholesterol. Okay, where this person lives. Okay, this person lives in the Gambia. Then now you have to track how a disease moves from person to person. Epidemiology is used more with the contagious diseases mostly, you know. And then we create rules and plans to keep communities safe. This is mostly speaking about public health. So, as I said, there are main types of diseases. Infectious disease, um, we track fast-moving germs like flu or viruses. With chronic disease, we study long term health issues like cancer or heart disease. And with environmental health, we look at how dirty is the air, the water, or food that makes people sick. So, when we understand the burden of disease, we know exactly what we are dealing with. So, so if you know a disease in your community, so study that disease. Who's getting diabetes, like let's say? Why are they getting sick? Who is getting sick? How am I supposed to help this person? How to avoid this? So sometimes we try to cover, we want to, we can know all the diseases of the world, but if you know enough about what affects your community, you will be in a better ground than most of the people. So remember, if you need to see how disease affects your community, then you will be able to help the community where you are. So, and also study yourself, because sometimes we try to help other people, but we don't know ourselves. So, and this is the fifth step that I wanted to introduce to you, and we welcome Brother Costa, and how to know ourselves. Remember that the first thing that we have to know is ourselves. Okay, do you know your labs? Let's say your markers. Do you know what is your hemoglobin A1C? Do you know how is your platelet count? Do you know your numbers? Do you know if you have any liver issues? Do you know you have any kidney issues? Do you know if you have any heart condition? Do you know if your ancestors, your parents, your grandparents died of a certain age, of a certain condition? So all of this puts you in perspective of what to expect about yourself. So okay, my parents died of. I'm not saying this is just an example. Oh, my mother died of breast cancer. So if you are a lady, you have to watch out for breast cancer and how to take the steps considering how to avoid getting this type of cancer. Let's say My child died of malaria. Okay, how do I avoid getting malaria? How is that affect someone? How do I recognize the symptoms of malaria that is endemic to my place? So when you know all of this, you are in a better position. Let's say you are not sick. You are able, go to a lab at least once a year, ask a doctor to make you an order, and have the basics every year, once a year. You have your labs, you have your kidneys check, you have to your you need to know your blood pressure, you need to know your blood glucose, and make sure that all those numbers are in an optimal range. Just don't wait until you start feeling symptoms, because this, remember, we are talking about prevention. We are not talking yet about treatment, because if we prevent, if I ask someone here, okay, what is your A1C? Someone will say, oh, I don't even know what that is. Okay, so that means the sugar in your blood for the last 3 months in a percentage. So, do you know what's your blood pressure? Oh, I don't know. So, it's better to know yourself. If your blood pressure is high, we need to understand why it's high and how to help you. Because if you get to a stage that your blood pressure is high, you might damage your eyes, you might damage your brain, you might damage your kidneys, and you might have a heart attack or a stroke. So you better watch it. So remember, know yourself. Then we have to ask the next questions. Is there access to preventive care where I live? Is it expensive? Can I afford it? Can I afford this? Or what steps can I take in order to prevent disease? And this is not to scare you. This is just to us to get ready for the big picture. Because if I know the health system, where to go, what to do if I get a disease, is there a way that I can afford the treatment? Is there a way that I can afford to pay the hospital bill, or or it's better for me to make sure that I remain healthy? That is the best thing that we want. And then, what does this health system have to offer? When I was in Tanzania with Brother Costa, there we saw that only up to age 5, the system will cover a Tanzanian. Now, how is in the Gambia? Is the system covering you your entire life for any disease forever, or is just a system where there is no doctors, where you have to pay out of your own pocket medications when you have no way to go to a system because you're going to be broke after visiting a doctor? So we need to understand that. Then we have to find out, is there good hospitals, bad hospitals? Is it expensive? Is it cheap? So then we start taking our health seriously. Then, according to my age, what screenings are necessary? So, and this is part of preventive care. We say, okay, I am 50, so 50-year-old people, they might get screened for high blood pressure, for diabetes, for cholesterol, for heart disease. So there are certain screenings that doctors do. And sometimes men, we don't like going to a doctor, not like women. Sometimes some men do, but most of the men don't like going to a doctor. They just like, oh no, I don't like going to a doctor. The doctor is gonna check me, he's gonna tell me that I am sick. And so we try to hide our head like the ostrich. The ostrich just goes there and buries his head inside the sand and try to ignore situations. And when we go to the doctor, sometimes it's unfortunately too late. So we don't want this to happen. So we need to know ourselves. Do you know how you feel when you are healthy, you know how are you sleeping well, are you eating well, are you properly nourished. So are you eating properly? Do you know that there are diseases just because you don't eat properly? Sometimes people get sick because they lack nutrients in their diet. Isn't it like that, Brother Costa? Brother Costa is a nutritionist. So what happens if a person lacks some vitamin because they don't have it in their diet? So we know lack of vitamin C, lack of vitamin A, lack of vitamin K, all of these uh, cause disease. And sometimes it's just understanding our own selves. Okay, when I understand that I'm not eating this type of nutrient in my own diet, do I have the means to get a food that contains this nutrient? Do I know what food contains this nutrient? Or do I get to buy a supplement? And sometimes I don't trust supplements too much. I have my doubts, and because supplements are not as standardized as pharmaceuticals. So anyone can make a supplement and trying to put anything on the label. Say okay, this has whatever. So it's relative what we can do with supplements. So the best option to get these nutrients is from our diet. So remember, can we have them in our diet? If we can have it in our diet, that's the best way to do it. So, any questions so far? I'm glad Brother Acosta is here. We start a little late, but we're gonna go for the first. Uh, we'll have another 20 to 30 minutes more. But if you don't have any questions, I'm gonna start with the first conditions that is more prevalent in the Gambia. And you may know, all of you know this, is malaria. No? And malaria is an infection that is caused by a parasite. This parasite is called Plasmodium. And there are different types of this parasite, more than 100 different species. But only five of these parasites, they cause disease in humans. That's Falciparum, Vivax, Ovale, Malaria, and Knowlesi. So these are the only five that cause this disease. And this guy, yeah, this guy here, is the one that is to blame for malaria disease because he is not the parasite, you know. He's just a mosquito that is anopheles, and it's not the male. It's only the female of this guy. So she is a female. She is feeding there in the human host. So this lady mosquito, I will say it like that. This lady mosquito, she transmits this parasite. So, and the symptoms that malaria causes are fevers, chills, headache, and nausea. You see, and these symptoms are like the same symptoms of a common flu. So, some people might say, okay, if I am in the US and I get fevers, chills, headache, and nausea, some people say, oh, you just got the flu. But if I am in the Gambia and I get fever, chills, headache, and nausea, I rather understand that it might be malaria. So I need to make sure that, even though they are the same symptoms, I am just going to tell you, okay, just go and have some lemon tea with honey and rest, because this is dangerous. This might kill you. So there's prevention, there's insecticide treated nets, anti-malarial drugs, and anti-malarial medications as a treatment. But let's understand a little bit of the cycle of this guy, So you are able to see um, it's a cycle. It means that this parasite, to survive, he needs to live in two different kind of hosts. One of the hosts is a human host, and the other host is a mosquito host. So when an infected mosquito um, bites a human, so he transmits some sort of a stage of these parasites called a motile sporozoite. So this motile sporozoite is in the saliva of the mosquito. And this sporozoite travels through the blood vessels, to the liver cells. So, and there he starts reproducing. This guy is not a good guy. So once he's in the liver cell, so he gets all what he needs, this sporozoite, and then he reproduces asexually. Asexually needs means that he doesn't need a female or a male. It's just asexually. That has nothing to do with sex. It's just outside of sex. Let's say, it's, it becomes a schizogony, and so producing thousands of merozoites. So I'm just giving you a broad understanding. So these merozoites, they destroy the liver cell and they travel through the bloodstream and infect red blood cells. So what we call um, these red blood cells, where they develop and they create another form. Let's say that these parasites have different stages, like humans do. Like you are a fetus, then you are a baby, then you are a toddler, then you are an adolescent, and then you are an adult. Okay, so this same thing happens with these parasites. These names are just names of the different stages of this parasite. So these merozoites, they infect the blood, the red blood cells. They develop in ring forms, trophozoites and schizons. And then they lyse or they destroyed the red blood cells. Imagine, so they destroyed these cells. So that's why some people get anemia, caused by this parasite, because this is when you start having symptoms. You get bitten, and then they start infecting your liver cells. You still don't have any symptoms, but once these are in the red blood cells and they start destroying, blasting these red blood cells, is when you know that you will start having symptoms. And these merozoites, they develop into precursors of male and female gametes. So now they need a mosquito host to do the second part, that is the sexual reproduction of the parasite. So when the mosquito bites a person that has been infected with the parasite, the gametocytes are taken up and mature in the mosquito gut. And now the male and the female gametocytes, they fuse and form an ookinete. And these ookinates develop in neosporozoites that migrate to insect salivary glands, and then the cycle continues. So this is just a broad understanding on how this mosquito and this human are hosts for this parasite. And once we understand this, we know exactly how to affect them. How to affect these parasites. We are so big and we are affected by these parasites, and we might get killed by this parasite. So we need to know that there is an ABCD approach to dealing with malaria. So A stands for awareness. So we need to be aware that, okay, we live in an endemic area for malaria. B stands for bite avoidance. So, okay, how to avoid being bitten by a mosquito, you know? C stands for chemoprophylaxis. So, if you are, this applies mostly for travelers. So, let's say I don't live in the Gambia, but if I travel there, some people decide to do prophylaxis, so means that they try to avoid getting the disease by taking some medications that the parasite dislikes. And D stands for diagnosis. We have to make sure that we get the proper diagnosis so we get the proper treatment. So remember how to prevent it. Bite prevention. So sleep under an insecticide treated net. So we call ITNs every night. So you live in an endemic, this is non-negotiable. Try to protect yourself, try to protect your family. Uh, you have some exposed skin, so try to avoid being from dusk to dawn outside, or if you need to, I don't recommend too much applying these insecticides on the skin, because this is what uh, regular medicine recommends. Apply DEET or DEET or picaridin to exposed skins, just a mosquito repellent. Maybe Brother Costa might help us to have some natural repellents later on, or we can find some natural oils that maybe mosquitoes don't like. So we try to do a different approach. So wear long sleeves and long pants during evening and night hours. Is install window and door screens or use AC if you are able to afford AC to keep mosquitoes out. So we try to prevent this guy to infecting us. So remember, this is a way that we can prevent. And unfortunately, even with the best measures, we might still get sick with this guy. So remember, spray indoor walls with insecticides, so residuals are really not good for your health. It available. Some local programs have this. And remember, clear out standing water around your home to stop mosquitoes from breeding. So this is the most important part. You avoid to having some stagnant water or some water that is not moving on some water. And unfortunately, in the Gambia, when it rains and when you have the river and then you have the ocean, so you have plenty of water. You have perfect conditions for this guy to survive and to get around. So we gotta do our best. And then medical response. Let's say you got infected. You started developing symptoms. You start having fever, nausea, this pain in your body. Then you start feeling like you have the flu. So get immediate attention. Go and have a blood test at your local clinic if you have these fever, chills, or flu-like symptoms. So remember, don't play with it. Don't guess. It might be the flu. Who knows? But then, since we are in an endemic part of the world, so we know that this might be malaria. So treat it. If you get a diagnosis, treat it quickly. Where there's medications that we call ACT therapy that is prescribed by a local doctor. And most of the African countries, they have a protocol because they have been dealing with malaria for so many years that now, you know, they know exactly what to give you. And once you are infected, so get tested, remember, the rapid diagnostic test, blood smear, well, to confirm disease. Don't guess, remember, never guess in health, and especially if it's not your own health. Because sometimes we try to guess about other people's health, and I say, okay, I think that the sister or the brother has this, so I might recommend this. Remember, we are not doctors, we don't diagnose. We are not here just to guess on other people's health. Start treatment and stay hydrated. Drink plenty of safe fluids, oral rehydration salts to keep your body strong. If you don't have money to buy these, just you can make a little, boil water. Try to filter as much as possible and add a little bit of sugar and salt and to able to be hydrated. And and remember, avoid, do not delay, because malaria can turn dangerous within hours. So do not delay treatment. Do not delay. So once you start having symptoms, remember we saw that when the parasites infects the red blood cells is when you start having symptoms. But you already have the parasite inside of you because he has gone to the liver cells. He has already destroyed liver cells. But now that these merozoites, they went to the red blood cells, that's when you start having symptoms, and you might have anemia too because they destroyed the red blood cells. Do not guess. Avoid using leftover or random pills without a positive test result. So don't start treatment until you are confirmed, diagnosed, and you know that you really have it because otherwise you're just taking medications just for taking, for the sake of taking. But let me tell you this: in case you are feeling really bad, you are really feeling bad. You are in this endemic area. You have no way to get tested. You have no way to go to a doctor. There is no health center around. You have no testing. You might have to start empiric treatment. But I do not recommend it unless you are certain. But it's better to do some empiric treatment. But sometimes, this might get you back. It's my no, no, it's not the ideal. It's not the ideal. So I don't recommend doing something just for the sake of guessing. So the best thing is to confirm the diagnosis. And this is just a little reminder of the symptoms, headaches, anything can give you a headache, even sinus infection, even respiratory infection, even a migraine headache, fatigue, you start feeling tired, like more tired, nauseated, vomiting, chills, fevers, muscle aches. So these are some of the symptoms to be aware of. And don't forget, you might be hearing this from your local health department, and they say, oh, it's nothing new for us. We already know, right? But it's better for us to make sure that we uh, review this prevention. So, how long till I get better? This is a general recovery timeline. First, 24 to 48 hours. You remember you will have fever, chills. Most of your symptoms should begin to noticeably drop once you start taking effective anti-malarial medication. From day 3 to 5, you will likely start feeling much better overall. The medication works rapidly to clear the parasites from your bloodstream. So don't play. I know some people say, okay, use garlic, use onion. Yes, those are very good. But remember, it's on the preventive stage that we use them. Once you are infected, you need to get this parasite out of you as soon as possible. Once you kill him, you use anything you want, but make sure that you kill this guy because otherwise, if you don't kill him, he's gonna kill you. And from weeks 1 to 2, a full cure is typically achieved and the standard course of treatment is completed. And from there on, week 2 or 3, you have, if you had a severe case or require hospitalization, it can take several weeks to fully regain your baseline energy levels. It takes a while. So why you might still feel weak? It is completely normal to feel intensely tired, weak, nauseated for a week or two after you finish medication. Remember that malaria attacks the red blood cells, and this might leave you temporarily anemic. Furthermore, the powerful medications required to kill the parasite frequently cause temporary fatigue and a bitter or nauseous taste in your mouth. So this is just like a side effect of the anti-malarial drugs. And some medical warnings: finish your medicine. You must finish every single dose of your prescribed medication, even if you feel completely cured within the first few days. Stop early. Stopping early allows the strongest parasites to survive and may cause a relapse. And if you have relapse, remember you have well, you don't get this Ovali. You might get Ovali and Vivax, but you mostly get falciparum. But Vivas and Ovali, they can hide in your liver, and they go into we call a hypnotic stage. So they go and sleep. So they go into a dormant stage, and then later on they return even months or even years later and cause disease. And then we have to start in a secondary medication to get out or flush out these dormant parasites. So when you have to look for help, so go to the ER, contact your provider if you have fever or you experience jaundice. Jaundice means that the white part of the eye gets yellow or your skin gets yellow. If you notice your urine is dark or bloody, you have difficulty breathing or severe confusion. So these are basically symptoms of complicated malaria, and you need to go immediately to the ER, to the hospital, and receive treatment over there. So, any questions? Now, I finished this part here, and I just would like to ask if there is any questions regarding everything that we talked about. And basically, remember, we only talk about preventive medicine. We are not talking about treatment yet, so we might focus next time in another common disease in the Gambia. I don't know if you wrote it down. I don't know, brother Angelo, brother Ibrahim, brother Samuel, brother Benjamin. So, are there any questions? Or maybe Brother Costa wants to say something. I don't know if he has any input. Hi, Brother Costa. Any any questions? Remember, if I cannot answer now because of the time sake, we're about to leave here, but if I cannot answer, we might have the answer for next time, or if I am able to answer now, we will answer any questions, regarding this specific topic, and I'd like to make sure that we, understand that prevention is key. It's key, your trash, how do you deal with your trash residues from your house, how you deal with any sewage, so the the most important aspect of preventive medicine is avoid getting sick. Is just hygiene, basic hygiene. Sometimes uh, it's hard for us to imagine, but many diseases affect us just because of lack of hygiene, and that's what I wanted to stress the most today. So,
Yeah, let me ask you a question with malaria. Yeah,
yes.
yeah. Is there anyone who his own blood cells cannot take malaria?
I'm sorry. Is
Is
anyone that
his own blood cell cannot affect malaria? Or
let me understand the question. You are asking if there are any are persons not affected by malaria, or
yes,
any
yes,
blood
can be
type,
affected.
or blood
Yes.
types, you mean?
Yeah, anyone, no blood type, but cannot be affected with malaria.
Oh, people who cannot be affected by malaria. Okay.
With malaria.
Sometimes people get, I won't say used to, used to malaria, but some people, they kind of developed, how is this word in English? And a symbiotic relationship with this parasite. So Even though malaria affects them, they don't get as sick as other people. Like, let's say if I go to a country that is where malaria is endemic, and I get bitten by a mosquito, I will get really sick. As opposed to some people who has been affected by the same parasites, and sometimes these people develop some sort of anemia that is called sickle cell anemia. And this anemia, they live perfectly fine with this disease their entire life. They don't even know it. But when you go and take a blood sample of the red blood cells, then you see in the microscope that these red blood cells, they look like a half moon shape, because that's the way the sickle is, and then uh, it's interesting that some people, they get kidney problems just for the sickle cell anemia, but some people, they are anemic, they have this infestation, and they still live basically, I will say, in quotes, normal life, but but we can know exactly which ones are going to be affected and which one aren't, but some people might, now knowing who, that's the big question. Yeah.
Yeah. The question I have about about the cleaning clothes. Yeah, because someone will clean his clothes. After then, he wear them, he take bath, and his body will normally scratch. I don't know what caused that. Clean clothes.
Okay, some people take a bath and then they
Say
feel
what
like,
again?
but
What?
they feel like a scratching all over. There might be
Oh,
several reasons. They have my dermatitis that is caused even by the soap or what the type of by the type of environment that they are. Sometimes people, they have very dry skin. With people with dry skin, they can itch, easily. Some people, since they don't have this protection in the skin, so they might have to use a lotion, just to apply a lotion, so help the skin. They have to drink plenty of water. Remember that if you don't drink plenty of water, then you might get this. And you have to check if you have a dermatitis, if you have any rash, if you have any type of skin condition when you feeling this. And also remember, you have to check that the water that you are showering with is good water, because sometimes even the same water you are showering or you are cleaning yourself with is unclean. So we gotta make sure that we understand, is the water, is it my skin, is it the products that I am applying, is it the type of clothing that I'm having on me, so there are several things that we have to analyze when you start having an itch after you shower. Yeah. So remember, we always have to
yeah.
to look from different aspects.
Thank you.
Yeah. Concerning the hygiene, about cleaning, washing off your hand. Okay, how many hours or minutes did a bacteria we take in your hand before it's dead? How many hour or minute bacteria we take in your hands
Where
before it's dead?
bacteria, depending of the bacteria, because sometimes we don't carry only bacteria in our hands. We carry bacteria, we carry parasites, we carry viruses. Even when we talk to each other, we share millions of viruses, just by talking to some person face to face. It's just, this is not to scare you, but that's common. We But when depending on the surface we touch and depending on the kind of bacteria, the hands are ideal. If we sweat, if our hands are sweaty, if our hands are dirty, that's the perfect environment to a bacteria to live there. So you never know. So it's better for you to wash your hands, and totally with a soap, hopefully a good soap. But the most important part is this running water. You wash it 30, 40 seconds. You scrub very well. You just your nails are dirty. Remember, as we said, you better make sure that everything is clean. And so bacteria, goes away, or you reduce. If there are 100, then after you wash, might be one. But remember, not all bacteria are bad, not all viruses are bad, not all parasites are bad. So there are certain that affect human health, and that's what we are trying to avoid getting sick. So remember, hand washing is the most important part in in our in our preventive medicine.
Yeah.
Any
Yes, you talk about we have to check doctors. We have to be checking our health to doctors.
Mhm.
In some areas, in some aspect, or in some lives, mostly in Africa here, uh, people don't get that privilege. People don't have that privilege to have home doctors, neither family doctors. Yeah, lack of the conditions that we are living here. Is it good for us to live by faith, in the word of God?
Well, brother, God knows our situation, but remember that faith requires works. Faith and works, they go hand in hand. We cannot just ignore some things, unfortunately, because of the conditions that we are. If you get, let's say I'm going to just give you a very simple sample. You get bitten by a dog affected with rabies. And some people say, oh, I don't believe in vaccines. They say, okay, so if you are bitten by a dog infected by rabies, 100%, 100% of the cases, you're gonna die of rabies if you don't get the treatment. So, the Lord can resurrect dead people. The Lord can have miracles performed. But we have to do our part. We have to do our part. So remember, it's very important that we do our part. And if or do the best in our situation. If you cannot get access to healthcare, if it's too expensive, at least try to get the best prevention that you are able to do so. Because sometimes people have some underlying conditions that could be treated, or people could help easily if they knew they have it. And sometimes you know there are conditions that just a simple blood test will reveal, that you are not able to see, or you are not able to feel anything. Sometimes people have some heart conditions they don't know anything about, and the first symptoms that they will ever get is a heart attack, or a stroke. And they say, okay, but I didn't have money to go to a doctor. So sometimes, remember, an ounce of prevention, as we said at the beginning, is worth what? A pound of cure. And this is what is stressed, because sometimes we save for other things, and when it comes to our health, say, oh no, I have no money for this. And I just wanted to add something to your last questions regarding the malaria asymptomatic carriers. People who live in these areas and get bitten many times, they build up a partial defense over time against malaria. No, their bodies they fight off several illnesses, stopping fevers, major symptoms, and some people they get genetic traits, that certain blood traits, just as I said, the sickle cell trait, they change red blood cells. This makes very hard for the parasites to grow and cause severe disease. So that's why some people, even if they get bitten repeatedly, they don't get sick. But still they are infected.
Okay. Thank you so much. God bless you.
Okay, Brendan. I don't know if Brother Costa wants to add something. I just have 5 more minutes to go because we have a meeting here and I don't want to get late there. So I'm sorry. I wish I had more time for you guys, but we will make sure that we have another talk, and this is being recorded. I will upload this later on to YouTube, and I will share you the link if you need to review any of these things. If any more questions you have, please write them down. Ask Brother Pastor Angelo to send them to me, and then we will try to answer the best to our ability.
Okay. Thank you.
Okay. Brother Costa, want to add anything or no?
God bless you. Right now I am aphonic.
Okay, that's why you are quiet. Okay, no problem. I
Okay.
understand. Okay, my brethren. So let's have a word of prayer and then we will dismiss this meeting. And next time, we will program the time better. And then, okay. Our most precious Heavenly Father, we are so thankful, Lord, for this opportunity that we had here to study about health with our Gambian brethren. We ask your special blessing to Pastor Angelo. There, give him wisdom so he can lead your church and your people in this area of the world. We ask you, Lord, for my dear brethren, for their families, so we may be a lighthouse in this part of the world. Help us, Lord, to understand that you want us to be healthy and to be head and not tail, and to show the world that we have wisdom. Forgive our sin, our trespasses, and also be with us during the rest of this day. In your hands we commit our lives, and in Jesus' name we pray. Amen.
Thank you very much. God bless you. Thank you. God
Okay.
appreciate it.